What is a sleep-deprived EEG for epilepsy diagnosis? Imagine trying to catch a glimpse of something that only appears under special conditions. That's what a sleep-deprived EEG does for diagnosing epilepsy. It's a test that looks at the brain's electrical activity, but with a twist. Before the test, the patient is asked to stay awake for most or all of the night. This sleep deprivation makes the brain more likely to show abnormal signals linked to epilepsy. During the test, electrodes are placed on the scalp to record brain waves. The patient usually arrives after getting only about 4 hours of sleep or less. The test lasts around 2 hours, and during this time, the person relaxes, sometimes with eyes closed or during light sleep. The goal is to see if sleep deprivation triggers any abnormal electrical patterns that might not be visible during a normal, rested EEG. These patterns, called epileptiform discharges, can help confirm a diagnosis of epilepsy, especially if seizures happen mainly during sleep or drowsiness. Sleep deprivation acts as a kind of activation method. It increases the chances of detecting seizure-related activity because some types of epilepsy only show signs during sleep or when the brain is drowsy. This makes the sleep-deprived EEG more sensitive than a routine EEG, which is done when the person is fully rested. Sometimes, the test also records during sleep stages because certain seizure activity only appears when the person is sleeping or transitioning into sleep. The procedure is safe, non-invasive, and painless. Patients are usually advised to avoid caffeine and alcohol before the test and to follow specific instructions to maximize the chances of detecting abnormal activity. Interpreting the results requires a trained specialist because sleep-related brain activity can sometimes look like seizure activity. That's why expert analysis is essential to avoid misdiagnosis. In summary, a sleep-deprived EEG is a valuable tool for diagnosing epilepsy. It uses controlled sleep loss to increase the likelihood of catching abnormal brain signals that might be missed during a normal EEG. This helps doctors make more accurate diagnoses and plan better treatment options. If you or someone you know is undergoing this test, it's important to follow all instructions carefully and discuss any concerns with a healthcare professional. Remember, each person's experience with epilepsy is unique, and testing is just one part of understanding and managing the condition.